Hello, everyone, and thanks for having us today. I'm Hilary Palotay, Director of 211 National Initiatives at United Way Worldwide, and I'm extremely excited to be here today with Lisa Boyd, Director of Social Impact at Lyft, and a longtime partner of ours. So before we dive into a conversation, I wanted to share a little bit about each of us. As the Director for 211 National Initiatives, I support a nationwide network of United Ways and nonprofit agencies that address over 14 million requests for assistance every year. More than 250 agencies operate 211, which is a free and confidential helpline that connects individuals in need with highly trained community specialists who navigate and empower those individuals through the complex social services ecosystem. My job is to connect national partners into this incredible work and the benefit of communities and clients across the country. Lisa is a founding member and leader of Lyft's social impact team. In her role at Lyft, she's spearheaded the creation, launch, and growth of Lyft Up, which is a suite of initiatives focused on increasing transportation access and equity for low-income communities. She also led Lyft's inaugural company-wide environmental, social, and governance reporting strategy. And of course, how do we actually do this work together? So since 2018, Lyft and United Way Worldwide have partnered to run a program called Ride United. This is a transportation access initiative that helps those in need overcome transportation barriers. To date, the program has supported more than 57,000 free rides to clients across the country. It helps them access healthcare, employment opportunities, public services, and even more. So with that said, let's dive in. Lisa, can you introduce yourself and share a little bit about Lyft's approach to social impact?
Absolutely. Thanks for that great intro, Hilary, and thanks to Social Innovation Summit for having us both here today. I have been at Lyft for a little over 3 years now and helped to really build our social impact and ESG programming from the ground up. As Hilary mentioned, one of the things that I focus on most is our Lyft Up programs, which is a suite of programs aimed at addressing transportation inequities for low-income communities. So to take a quick step back and talk about Lyft as a whole, our mission statement is to improve people's lives with the world's best transportation. So social and environmental impact has been core to our business and the way that we work from day one. And that's why we always try to focus on our product and our service as a primary way to make an impact. Any company or individual can write a check, but something that we can uniquely do is provide transportation access to folks in need. So we are well aware that transportation deserts as a whole are a massive challenge and something that we are not going to solve overnight. So with our Lyft Up programs, we really aim to focus on specific use cases where transportation can be a game changer for an individual or a family in need. To give you a couple of examples, we have a jobs access program that helps people get to and from job interviews, job trainings, or the first few weeks of work until they have enough cash in their pockets to pay for transportation moving forward. We also have a grocery access program helping people who live in food insecure areas, whether that be food deserts or food swamps, get to and from the grocery store, a voting access program to help people get free rides to the polls, and more. To run these programs, though, we rely on amazing nonprofit partners who have boots on the ground, really understand their communities, and have that built-in network of individuals who do need support. And so we have over 700 nonprofit partners that we work with through our Lyft Up programs, both hyper-local organizations in one community, as well as major national organizations. And one of our biggest and longest standing partners is United Way, which is why I'm so excited to have Hilary here to chat with her more about this. Hilary, can you tell us more about United Way and the 211 network and how that works and how we work together?
Yes, absolutely. So each year, 211s receive over 250,000 requests for transportation assistance. On average, about 25% of those requests are unable to be supported using existing community resources. Closing transportation gaps is critical for securing employment, addressing and accessing medical care, obtaining healthy food, and even escaping emergencies and crises. Through our partnership with Lyft, we're able to access Lyft products and services and then connect them into local 211 and United Way networks. Essentially, clients in participating markets are able to call 211 to request transportation assistance. 211 specialist vets all the available resources for the client, and if eligible and other resources don't exist, they can schedule or dispatch a free ride on behalf of the client, or provide a Lyft code, like a ride code, that they can use themselves. We collect quantitative and qualitative impact for this program, and I wanted to share at least one story of the impact of this work. So this is from our 211 United Way in Central Maryland. When the pandemic hit, a 211 caller knew she was in trouble. Even with the unemployment benefits, she would not be able to keep her car on the road, pay rent, to stay in her home, and pay the bills associated with just surviving. Although she kept applying for businesses that were still open, hiring was slow and often disappointing. The caller soon lost her vehicle and felt she was not going to be able to take the job she wanted again. The caller then heard about the Lyft 211 program. She states that she was able to get a Lyft ride to a job she actually wanted, and days later found out that she was hired. When asked why this ride made such a difference, the caller replied, "I might not have even gone. It's expensive catching the bus to these job interviews, and I wish this was available for all job interviews." Something I love about our partnership between United Way and Lyft is that we've built such a strong foundation for our programs, and it makes it even simpler for us to execute quickly when something unexpected comes around, whether that's a natural disaster in a region where we need to help folks move around safely, or of course, a global pandemic. So Lisa, can you talk a little bit more about Lyft's response to COVID and how that's kind of impacted your work?
Absolutely. And I think you're spot on, Hilary. When COVID hit last March, one of the things I was most proud of and grateful for was our solid bench of longstanding partners who we were able to tap into, gain insights from, and start immediately working with. We didn't have to start from scratch and figuring out how to respond. We knew what we were going to do and who to do it with. So first off, it's worth noting that although many people were fully sheltered in place, especially early in the pandemic, many low-income communities were disproportionately in jobs that required them to continue going to work. And at the same time, public transit in many cities decreased substantially, wasn't as available, and it left folks without a reliable way to get around. So there was a huge transportation need. What we did to step up was Lyft provided over $1.5 million worth of free rides to help under-resourced communities access food, essential jobs, and services. Over 200,000 of those rides were specifically to help healthcare workers across thousands of hospitals get to and from work. And we also provided 1.1 million free and bike and scooter rides to help frontline workers get to and from work. So really helping to address those needs of the community in the moment. One other thing, as I kind of reflect back on last year, which I'm sure will resonate with everybody listening today, was how much flexibility was required. We had lots of great plans that got thrown out the window, and we had to kind of overnight change our approach and respond to what was needed in the community. So one great example of that is Lyft's pilot in 2020 to supporting delivery work. As I'm sure many of you know, in early 2020, Lyft only moved around people, but come the pandemic, we started moving around goods as well. So we actually launched a B2B delivery service as a company. And part of that was driven by overnight, we saw an immense need and all of these inbound requests from our nonprofit partners to help get food to the doorsteps of low-income families and seniors who do not have food and were sheltered at home. And so we launched a number of pilot programs together with local nonprofits and local governments to do meal delivery to these community members. And last year alone, we delivered over 2 million free meals to individuals in need. So it was a really successful pilot, but something that if you'd asked me 6 months earlier, I would have had no idea was coming because it wasn't even a service that Lyft offered. So lots of changes, lots of unexpected opportunities, but also, a great example of how when you have the base of those partnerships and an understanding of where your value can be, you can, pivot quickly and be able to respond to those needs as they come in.
Yeah. Wow, I couldn't agree more. And not only did United Way get to partner with Lyft to provide rides for individuals in need throughout all of 2020, we also started working together at the end of last year on something equally as important, the Lyft Up Vaccine Access Program. So can you talk a little bit more about how that program came about?
Yeah, definitely. So an interesting thing that we were seeing at the end of last year was as people were starting to talk about vaccine distribution, they were talking about how to get the vaccines to pharmacies and to mass vac sites, but no one was talking about how people were going to get to those sites, which is especially important, especially for low-income communities, seniors, communities of color, those who were hardest hit by the pandemic. We know that in an average year, 6 million people miss medical appointments because of lack of transportation. And this is not an average year. And, the need was going to be there. And we saw how this was going to play out in terms of lack of access or equitable access to the vaccine. So we jumped into action at the end of last year and brought together many of our nonprofit partners to launch our Lyft Up vaccine access program. We're working, as with most of our Lyft Up programs, with tons of partners supporting different community groups. A few examples include the NAACP, the National Urban League, National Hispanic Council on Aging, National Asian Pacific Council on Aging, and many more. And of course, United Way is our largest partner in this work as well. So Hilary, this has been, we've done a lot of programs together, but this one has been particularly complex. Can you talk a little bit about some interesting insights or thoughts from your side?
Yeah, sure. It's safe to say that the past year and a half has been an ever-changing landscape for most of us. 2-in-1s and United Ways across the country stepped up to support COVID response in many, many ways, including managing COVID information hotlines, supporting contact tracing, conducting intake registration for CARES Act funding. You name it, we've been adapting to support millions of people every day in communities nationwide. So it was a natural step for the Ride United program to expand from its initial work that we were doing together to providing transportation for accessing vaccines. Then once again, as the development and the rollout of access to vaccines first began, we've seen changes at the county, state, and federal level, and our teams and partners have been working hard to adjust and support these efforts. The plans we helped build back in December look very, very different now than they did then. But the foundation that we built over the past few years working together was really essential for making this work possible. What's clear is that we need to be flexible, adaptable, innovative, and persistent. With that said, we were able to grow the Ride United program from 12 pilot communities in 2018 to more than 123 cities and towns today. What's essential now is also ensuring that as many people as possible who want the vaccine get access to it. So we've been driving folks to the Lyft Vaccine Access webpage. That's lyft.com/vax, VAX, for up-to-date information on where and how they can get free rides. And teams are able to support the communities that are opting into this work. What's really great about the 2-in-1 and local United Way implementation is that because we are trained call centers, we're able to support those that don't have internet, smartphones, or banking information. They can help get access to a ride. Next up for us is really ensuring that all of this expertise and infrastructure that we've built around vaccine access is used for longer term COVID recovery, like rides getting folks back to work, helping them get to non-emergency medical appointments, and accessing food. But I know we're getting close to the end of our time. Before we close out, can you tell me one project that you're working on aside from vaccine access that you're excited about?
Yeah, absolutely. You actually just alluded to it. One thing that I'm super excited about is diving back into our grocery access work in a deeper way. During the height of the pandemic, food insecurity increased by about 460%, according to Brookings. And thankfully, it's come down a bit since then, but Feeding America still anticipates 42 million people will face food insecurity in 2021. And in particular, there are major racial disparities in that access. Feeding America also projects that 21% of Black individuals will experience food insecurity compared to 11% of white individuals. So there's a huge amount of work we still need to do on this. And I'm really, really excited to dive back into that. And specifically, bear with me, but one really wonky thing I'm super excited about is we are starting to do some really intense third-party research to understand the true outcomes of this work. We've seen really positive qualitative outputs, immediate, the number of rides, the feedback from the program participants. But one thing that we're really excited about is diving into how this work actually affects people's health metrics, their claims data, the insurance companies, et cetera. And if we can think about those really long-term ways that this program and helping people access healthy food increases health metrics, then we can hopefully work with much larger entities like Medicaid or insurance providers or groups like that serve communities at scale to think about how we scale this program beyond what Lyft is able to do alone. So that's something I'm super, super excited about in the coming year.
I love that. Well, I think we're out of time. Thank you so much, Lisa, for a lovely conversation.
Absolutely. You too. And thanks again to Social Innovation Summit for having us. Back to you, Olivia.